and today we are going to present a case study from the past year of Vispa partnering with Mercyhealth. And so I think we all know March of 2020, much of healthcare was completely disrupted. What was the norm was no longer the norm anymore. And so with that, I got a phone call from Kim, I think it was March 20, and it was a quite desperate phone call. And with that, I'm going to let her tell you a little bit about her organization at that time.
So Mercyhealth is in Wisconsin and Illinois. We are a vertically integrated healthcare system. I have 6 hospitals, 800 employed physicians, and 85 physician practices. We are actively building our 7th hospital and additional physician practices that will open in January of 2023. I joined Mercy in February, technically February of 2020, before COVID was a real thing. And March 23rd was my official first day, so let that sink in for a second. I called Geneva and I said, look, I've got a major problem. It was part of the reason why I joined Mercy. Mercy had extraordinarily aged AR, a severely understaffed revenue cycle, and some serious problems. And oh, by the way, guess what? COVID's now here. So now I have over $300 million in aged receivables. So Geneva and I started talking, and we quickly realized that the system that we had in place at Mercy, or that we still have, was not appropriately optimized. It created some major challenges for us. And so as we started talking through the potential solutions, and I was very aware of what Vispa did, we started thinking about this was the perfect solution for my organization. So to give you a little bit of context of what we're up against, I had 4,000 work queues in the business office. That's what I was up against. So we called Vispa.
Yes, and Vispa has taken a new and fresh approach to follow up. And we had many conversations about how we do things. Vispa really houses all claim accounts in one universe. So we don't use work lists, we don't use work queues. Everything is all in one account, and we automatically prioritize and present those claims to follow-up staff one at a time. So a whole new approach, and probably couldn't have been a better time to implement something new when everything was already disrupted.
Yeah, it really was sort of the perfect storm for us. And so when Vispa came in, we had folks that were doing cradle to grave, right? So they were doing everything in the business office. We didn't have any focus. We're large enough, right? I mean, we're a $3 billion organization. We're large enough that we can have follow-up reps and billing reps, and we didn't have that. So we quickly changed that mindset. I all know everybody wants to do a good job, but the general frontline staff, they're going to cherry pick the things that they know that they can resolve quickly and that aren't going to be too hard for them. Vispa doesn't allow that. It's very hard for people in revenue cycle to wrap their heads around this. Look, I've been doing this 20 years. I did 10 years in industry, I did 10 in consulting, and then I'm back in industry. This is a totally new way of thinking. We are not in a work list environment. My user logs in, it knows this is Kim Scaccia, she needs to work this type of account, and oh, here's the next most valuable account because it's your highest dollar, or it's about to hit timely, or you got a massive denial that's come in. And if Geneva logs in at the same time, she's getting the next most valuable account. They don't get to cherry pick. There's no lists available for them to say, oh, these are easy, I'm gonna work them. So that day is gone. The other thing that Vispa did for us, when we think about the right accounts at the right time, it allowed us to ensure that my staff that was now at home, we didn't have the infrastructure. We had no way to monitor our teams. It just wasn't available. In most electronic health records, in order for us to monitor and measure what people are doing, we're running every single user, what they're doing. I can see how long they've logged in, how long it took them to work in between accounts. And oh, by the way, I can also see, did they take the right action? That's critical. You know, I heard role. Is Geneva more effective than Kim? Or is Kim more effective? And then I can go to Kim and I can say, hey, what are you doing that your resolution rate is 85%? And can you help us teach the rest of the staff, what are you doing that's so different? So the metrics are completely embedded. And this year I love it because Vispa actually built some competitive metrics so that the users can actually see where they rate, which is super fun.
Yeah. And they really are competitive.
Yeah, they really have become
interesting.
competitive.
They want to make sure they get the right credit for taking the right action, and it really has. There's a little gamification in it, and so I think it's an interesting approach because it's a positive motivation to dig in and do the hard work. But really, what you're doing is working smarter, not harder.
That's exactly right, because we're taking out it's exception-based workflow. We're taking out the accounts that users don't need to work.
Right.
For 100 years in revenue cycle, what's been the norm? I'm Medicare, so I have to touch my account every 21 days because it should have paid by now. It doesn't work like that anymore. If I have a promise to pay or if I know Medicare sent me a check, take it out of my work list. If I just sent a bill yesterday, take it out of my work list. So we did away with that whole work list mentality, and now I'm presenting the right account to the right user at the right time. And I have all the metrics that I need. And with the whole pandemic that's continued, now we are able to mark people who are working from home, if they're not working from home. I even have an overtime flag now, which is so cool because with the recruitment issues that we're having and trying to recruit new staff, I now have an overtime flag so I can monitor what are they doing when they're working their overtime and are they being effective while doing overtime, which is so great. So.
Right, and so the thing that is really cool about Kim's story from this year is the results that she got. And, I'm proud. I'm proud because last year was a tough year. The past 18 months have been tough. And so, but they've had some pretty remarkable results, and I'm going to let her tell you about them.
We couldn't have got through this year for sure without a partner like Vispa. We did a lot of things. I mean, we brought in a lot of technologies, but our fiscal year ends on June 30, so these are results as of June 30. I think the biggest one that screams up here is we reduced our AR days by 34 days. That tells you in and of itself how bad the AR was when I got there. But we also ran the analysis to decide we're all in revenue cycle. We know that's not all cash, right? So, but we were able to break that down, and it was a third in cash, a third in my adjustments, and a third in bad debt. So that's a big deal. I beat my annual collection target by $20 million in June. I had the single highest ever cash collection day for Mercyhealth. I had an $11 million cash day. It was a big deal. I run about 4. And the great thing about all of this is as we've gone through this whole process, I spend a lot of time thinking about what's next. How do we get to what's next? And I call Geneva a lot, and I'm like, hey, can we do this? Can we do that? With our staffing challenges, we had a single specific payer that was a challenge for us. And so I called Vispa and said, can we do X? So we talked about it for, I think it was 2 or 3 days. And within 4 days, we had a solution. Boom, turned on. I now have staff that are focused on that specific solution. The newest one that we're having a lot of fun with, and one of you just talked about this a little bit. So I called Geneva 3 weeks ago and I said, hey, I want a payer scorecard. I've got a brand new denials team. My managed care team's starting to hum. I'm getting sick and tired of going to these meetings and, as someone said, having a fight with them. Now, we're 99% to a payer scorecard. I know exactly how the timing. I know exactly what's going on.
Right.
It's just such a fun environment.
And so we end with, it's not you, it's your software.
Partner.
And Kim always says, it's your partner, software partner. And so we truly, as you can see, we are really collaborative, and that is just how we approach everything. There's a quote I love, how you do anything is how you do everything. Well, we partner, and I think the best solutions come out of that kind of environment. So thank you very much. And we are right over here, Vispa. You can, if you have any interest in seeing what our solution looks like, come over to our booth. We would love to give you a sneak peek. Thank you.
Thank you very much.
Thank you all.